So vagus nerve problems. One would be a difficult speaking or loss of voice, hoarse or wheezy voice, trouble drinking liquids, loss of the gag reflex, pain in the ear, unusual heart rate, abnormal blood pressure, decreased production of stomach acid, nausea or vomiting, abdominal pain, or bloating. According to a 2018 review in the Journal of Inflammation Research, the vagus nerve can treat chronic inflammatory diseases such as sepsis, lung injury, rheumatoid arthritis, and diabetes. The vagus nerve is correlated with the immune system because nerve damage may be related to autoimmunity and other diseases. Chronic diseases such as alcoholism and diabetes can damage nerves, including the vagus nerve. The reason for damage is not clear. Damage to the vagus nerve in patients with insulin-dependent diabetes can cause nausea, bloating, diarrhea, and gastroparesis, which is slow gastric emptying. Inflammation triggers blood clotting. Inflammatory cytokines are the main mediators involved in coagulation activation. The inflammation-coagulation interaction overwhelms the natural defense system and manifests itself as severe sepsis or inflammatory bowel disease. Pathogenesis of internal meridian 19 article states, all pains, itchiness, and sores correspond to the heart. In TCM, the heart governs the mind. The heart is considered fire and governs blood. To treat the heart fire needs to be removed, the heart blood needs to be nourished and moved, and the mind calmed. So increasing the vagal tone to improve cytokine production. 90% of the vagus nerve fibers participate in inflammation, hunger, fullness, and energy metabolism. And it also participates in secretion of gastric acid and digestive enzymes, as well as gastric capacity, which are the other 10%, sorry. So the anatomy includes the thalamus, the amygdala, the locus coeruleus, the medulla oblongata. So the vagus nerve is attached to all that. Its activity is influenced by the visceral nervous system, the nutritive components, and relaxation techniques. This all connects to the stomach, the small intestine, and large intestines. So certain disorders, psychiatric disorders such as major depression, PTSD, inflammatory GI disorders such as ulcerative colitis or Crohn's disease. So the brain-gut axis. There is a brain-gut axis between the brain and the gastrointestinal tract. The vagus nerve is closely related to the digestive system, so stimulating the nerve can improve irritable bowel syndrome. 80 to 90% of neurons transmit sensory information from the stomach and intestines to the brain. The brain understands the state of muscle contraction, how fast food passes through the intestines, and the feelings of hunger or fullness. Bacteria in the gut communicate with the brain through the vagus nerve. The brain-gut axis has another counterpart, which is the bacteria in the gut. This microbiome communicates with the brain through the vagus nerve, which not only affects food intake, but also affects mood and inflammation.